Thank you so much, Lucia. It's so great to join you all today. And what an exciting day, and thrilled and honored to moderate this panel of expert speakers. Speaking today about COVID-19, climate, racial injustice, and the path forward. And we truly have an outstanding set of panelists joining us who are going to share with us a roadmap for the path forward. And my colleagues in the Department of Environmental Medicine and Public Health, who in many ways represent the many future leaders of the field, are going to be introducing them. And so I'm going to turn it over briefly to Teresa Herrera, who will introduce our first two panelists.
Thank you so much, Dr. Galvez. My name is Teresa Herrera, and I'll be introducing Dr. Gary Butts, who is a professor with tenure in the departments of Pediatrics, Medical Education, Environmental Medicine, and Public Health. He is the Chief Diversity and Inclusion Officer and Executive Vice President for Diversity, Equity, and Inclusion for the Mount Sinai Health System, and Dean of Diversity Programs, Policy, and Community Affairs at the Icahn School of Medicine at Mount Sinai. I'd also like to introduce another panelist who will be joining us later, Peggy Shepard, who is co-founder and executive director of We Act for Environmental Justice and has a long history of organizing and engaging Northern Manhattan residents in community-based planning and campaigns to address environmental health policy. She has successfully combined grassroots organizing, advocacy, and community-based research to ensure that the right to a clean, healthy, and sustainable environment extends to all. Now I will pass it off to my colleague, Christopher Bland.
Hello, everyone. I'm Christopher Bland, and I'll be introducing our panelist, Dr. Aaron Bernstein. Dr. Aaron Bernstein is the Interim Director of the Center for Health and the Global Environment at Harvard C.H. Chan School of Public Health, a pediatrician at Boston's Children's Hospital, and an assistant professor of pediatrics at Harvard Medical School. He focuses on the climate crisis, children's health, and advancing solutions. Through Climate MD, he encourages physicians to transform climate change from an issue dominated by politics and concerns about the future or faraway places to one that matters to every person's health here and now. I would also be introducing the panelist, Harleen Marwah, who is a fourth-year student, medical student at the George Washington University School of Medicine. She earned the 2020 Healthcare Without Harm Emerging Physician Leader Award in recognition of her work founding and leading medical students for a sustainable future, a community of over 340 medical students in over 80 medical schools taking climate action for health. She collaborated with the United Nations on the Paris Climate Agreement, attending the Conference of the Parties 2020 in Peru and 2021 in France. Harleen looks forward to her career as a pediatrician, working towards a healthier, more just and equitable future for the rising generation. And I'll be passing over to my colleague, Luz.
Thank you so much, Chris. Hi, my name is Luz, and I'll be introducing Dr. Lynn Richardson and Dr. Caren Solomon. Dr. Richardson is a professor and vice chair of academic research and community programs of the Emergency Medicine, professor of population health, science, and policy, and founding co-director of the Institute of Health Equity Research at the Icahn School of Medicine. Dr. Richardson is a practicing emergency physician and a nationally recognized expert in health services research focused on the access and barriers to care, improving healthcare utilization, and healthcare disparities. And now I'll be introducing Dr. Caren Solomon. Dr. Caren Solomon is deputy editor of the New England Journal of Medicine and an associate professor of medicine at Harvard Medical School, and a physician at the Fish Center for Women's Health at Brigham and Women's Hospital. At the journal, she oversees a series of review articles, clinical cases, and original articles related to women and has published on climate change and health. Dr. Solomon co-chairs the Harvard Medical School Faculty Council Subcommittee on Climate Change, is a founding member of the Climate Code Blue in a local group of physicians committed to climate action, and is involved in the Harvard divestment campaign. And I'll pass it over to Maida.
Thank you so much, Teresa, Christopher, and Luz. I just want to remind the audience, if you have any questions, please submit them in the chat and we'll try to get to them towards the end of the session. And we're going to dive right in with some questions, beginning with a question for all of the panelists. We're going to start big picture. When it comes to COVID-19, climate change, and racial injustice, what's the single transformational change you want to see most? And how do we get there? And I'm going to start with Dr.
Did you say you're going to start with Dr. Butts? Okay,
Yes.
you're coming and going, and my video wasn't giving me access. So first of all, thank you for allowing me to be here with these, preeminent and truly recognized leaders in this space and for this work. And before I answer your question, and I'll be real brief, and then later on dig in a little bit deeper. I still believe, and I think that this conference is timely in all kinds of ways, and I don't have to say a lot. But I just want to make a point. Despite the constant reminders, including what's happening in Washington, D.C. This week, that remind us of the inequities across our nation, across the world, we still remain this is a very special moment of opportunity. And this is the time, if not now, then when, to leverage the focus on this work, embrace the energy to advance the cause in some very, very deliberate ways. And so to answer the question, I would say very briefly that from my perch as a person who has landed in the diversity, equity, and inclusion space and spent at least half of my career in it and with it and on it, that we need to big picture embrace equity as a core value as part of our mission. Right? And what does that mean? That means applying, and Len Richardson spoke to this a little earlier, but applying that equity lens to everything we do and everything that we believe is important. Okay? And that can look like all kinds of things, but you name it, we can innovate in that space. Right? And how do we get there? Let's be very concrete. Because I don't think that we're yet as comfortable as we need to be at being uncomfortable talking about race and racism right now. We can't call it what it is and call it out, then it almost doesn't exist, right? That's a heavy lift. And I'll say a little bit more about where we are with that lift, collectively, because that's the other part of it. This can't be done alone. It can't be done just with people like us on this who have activated ourselves already to these issues. It's got to include, in a very authentic way, the leadership who often don't look like us or have not been in these spaces for very long, in order for us to truly be successful in digging in and broadly with these issues, deliberately and over time. Right? So that's my, I know that's a little less than the 3 minutes or so I was given, I think. But anyway, we can talk a little bit more about that in a little bit. Thank you.
Thank you, Dr. Butts. We'll turn to you next, Dr. Bernstein.
Thanks, Maida. It's nice to see you. And I share Dr. Butts's acknowledgement of the company that I get to share on this panel is really wonderful. I'm going to give 2 answers. One is to the medical community and the other is beyond, because I think there's things we can do. I think to the medical community, we think about climate, equity, and COVID. I'm persistently reminded that the people I work with at Boston Children's do not look like the people we serve. And we constantly see explanations that we can't find these people to serve as clinicians. And I think we need to do a much better job of reaching into the communities that we need to become members of the healthcare community to serve as clinicians, nurses, pharmacists. I think that's actually a core piece of the solution, that we need to have better care for patients who are at risk. I also, of course, think we need to get our own act together when it comes to our investments in fossil fuels, our reliance on fossil fuels that disproportionately burden people of color and poor Americans. Turns out there's some 400 plus healthcare systems in the United States, and only about a couple dozen have done anything, even said something about what they intend to do with the problem of air quality and climate change that we're responsible for. Outside of the 4 walls of medicine, and this may come a bit out of left field, but let me explain. I think the solution we need is campaign finance reform. What we saw in this election is that when Black Americans vote, things change for the better. In Georgia, the reason we have 2 senators who are Democrats from Georgia is because Black Americans were able to vote. And that was despite immense amounts of money being spent to keep people away from the polls, the gerrymandering, the frank disenfranchisement efforts to disenfranchise huge numbers of disadvantaged Americans. The only way we get true democracy is when people are allowed to make up their minds for themselves and are empowered to vote. And in a system in which people with lots of money get to essentially influence who wins, and the status of economic opportunity and wealth in this country, the game is totally rigged. And we have essentially in the past decade in this country moved away from more democratic processes into more and more oligarchic ones. And so if we really want to talk about equity and what we can do, we have to give people fair voice. And I think campaign finances, and that's as true with equity as it is with climate. There's no question that large sums of money have been spent by very small numbers of people to confuse people, disenfranchise people, and I think we have to take that head on.
Terrific. We have quite a list so far from the 2 first speakers. I'm going to turn it over to Harleen Marwah.
Hi, thank you so much for having me. For the last many weeks, I've been thinking about what I could add to this esteemed and experienced panel, and everything that I had come up with really evolved over the last week. I'm actually living in Washington, D.C. right now, and when sirens were wailing outside my window on Wednesday evening after the citywide curfew was put in place, it was really a stark reminder of the complex issues our country and our world face. And while no one single change is going to resolve these issues, we know that to get closer to solutions, we must champion diverse and multidisciplinary collaboration. Like many of my colleagues and mentors here have alluded to, these are very complex issues. And during medical school, we learned the basics of collaboration and the importance of teamwork when tackling complex issues. And we must elevate and amplify the voices of those who are traditionally marginalized. We know these are our issues in health, and this is absolutely our lane. And during medical school, I started to learn the privileged voice that we carry as health professionals. And I've also started to expand that to our duty to bring others to the table. So in our writing, in our research, in our teaching, in our clinical care, we must continue to actively welcome diverse voices and center justice in our work. As a medical student and a leader of medical students for a sustainable future, I've seen firsthand the energy and the passion of our rising generation of leaders. We're strengthened by our diversity, and we must uplift our rising leaders who are bringing fresh, innovative, and needed perspectives to the conversation. Our MS4SF community created this video message for the 50th anniversary of Earth Day. And our students say, on the other side of crisis, there is opportunity, there is resilience, there is hope. And I truly believe that through collective and inclusive action, we can create that opportunity, we can build that resilience, and we can generate that hope. Thank you.
Thank you for that. Our team at Mount Sinai watched that video, and we were in awe of the power of your voice. Yeah, great job. I'll turn it to you, Dr. Solomon.
So again, thank you for including me. And I want to say that it is actually challenging going after my colleagues who have stated quite eloquently many of the points that, that I would make. But I, like others, certainly think that what we need is a absolute shift from kind of a focus and a premium on, accumulating personal wealth to a shift to equity. And as for how we get there, I was going to suggest dismantling capitalism, but I didn't think that would necessarily go over with the group. But I think what we really need to be doing are actions that have already been championed by the many eloquent speakers in the conference beforehand. But we need to be bringing different voices to the table, and we as physicians and healthcare providers need to be involved in pushing legislation that is going to have equity as a centerpiece. So I would just bring up, what we're hearing about the proposed Green New Deal or whatever, Biden may call it. But the idea that we are moving to a sustainable future, but as part of that process, we are making sure that people have jobs and they have a livable minimum wage and they have access to healthcare, and that the key voices are at the table from marginalized communities to weigh in on legislation. And I think Ari has already touched on an important part, that getting those things through also relate to how our legislators get their funding and making substantial changes in that. But I think our being an active voice in pushing through policies that are going to improve our outlook with respect to climate change and also increase equity are what we need to work on.
Thank you, Dr. Solomon. And I'm going to turn to you, Dr. Richardson, for the final word on transformational change.
Thank you, Maida. So my answer to the question is actually embedded in your question, that this is a time where we need transformational change, that you can't, how does it go? You can't solve problems with the thinking that created them. And so the way we think about the COVID pandemic, the way we think about climate change and what it's going to take to reach sustainability, and the way we think about racial injustice really has to be fundamentally different than the way we have thought about these things for the past 400 years. I guess for climate change, maybe it's only 50 years or so. And it is going to take innovation. It is going to take bringing voices that are usually marginalized to the table, as others have said, that it can't be business as usual. And maybe, again, this is another one of those silver linings of the COVID pandemic, that surely everyone now sees why the health of everyone has to be the concern of everyone. Because now we have an infectious disease where you really can't, your wealth doesn't protect you, your social status doesn't protect you. It certainly lets you mitigate your risk to some extent, but really the only protection is for us to have a situation where everyone's risk has been addressed and everyone has been made safe and everyone has access to health care. And that's the kind of restructuring that we're going to need so that we are never in this situation again. And it's the same kind of restructuring we're going to need to actually do what we need to do to address climate change. It can't be incremental change. It's going to have to be transformational.
Thank you, Dr. Richardson. That's a real call to action for all of us. Peggy, Shepard, we are so happy that you could join us again. I'm going to turn to you. The question was, when it comes to COVID-19, climate change, and racial injustice, what's the single transformational change you want to see most, and how do we get there?
Well, I think the Harvard study really put a pin on the issue of why Black people were dying at higher rates. And I think as a result, the city began to reach out to those particular communities in a stronger way. But again, I think that's why it's so important for people like all of you on this panel to share the research and to share the data. Because if we had understood, if the city had understood that at the very beginning, they would have started with those communities in the Bronx or those communities in Harlem that were having the highest death rates, to really let people know how important it was for them to be quarantined, to use a mask, and to put extra public health assistance in those communities. And so right now that doesn't sound very transformational, but those are still the communities that need the most support and assistance. And right now, with the death rate at 4,000 a day, that would still be transformational to have that kind of assistance in those communities, which are also the ones saying no to vaccinations. And so again, being able to model and having community folks who they trust model the fact that this is important to do, it's safe to do, I've done it, I think becomes very important. I don't know if it's transformational, but it will certainly save some lives in the next few months.
Thank you. That is quite a list. And I think what's so impressive about what you all shared is that none of those things are things that were taught in medical school. You've all gone way upstream. And so I'm wondering, sort of transformational change, innovation, thinking outside of the box, embracing equity as a core value, decreasing our reliance on fossil fuels, campaign finance reform, partnerships, meaningful partnerships across communities and with people of different backgrounds, shifting personal wealth, and changing capitalism and how it works and who it benefits, living wages and access to care. All of what you've mentioned, how do we get medical students, allied health professionals, all on board with this so that they can be the champions of change that help work with communities to achieve this?
Well, I would say that some of your medical students should just walk right across the street and begin to have meetings with the residents in the public housing across the street, and perhaps even visit some of those homes to understand the conditions that people are living in, and then maybe they would understand the health outcomes that they're seeing. So that's a good start. Understand the community conditions in which you're studying, in which your hospital is.
I want to add to that because I've heard it a few times said this way, and I wasn't sure I was embracing it conceptually until recently. And Peggy, by the way, when Mount Sinai started, when it was Mount Sinai School of Medicine many years ago, part of the community medicine course included precisely that, right? And that's how Mount Sinai, that was an expression of the values of the institution, more directly, more deliberately, as it related to the education of the next generation of physicians. But the term I want to put out there is, we have to get at the hearts and minds first, right? And because a way to do it is to have folk experience what we're talking about in some very genuine ways that move them. And then it's about the data and how you address the data and become part of the solution and not part of what has been, unfortunately, a perpetuation of what was, what is, right? So I think, and the other point I want to make, it requires to get there, and I think that we're there. This is why the point I made earlier. We're at a point where our institution, from the very top, is watching, is looking, is expecting change, kind of in the transformational ways that we're talking today, with the recognition that incremental change is not going to get us there. It's backwards. And sitting by and doing nothing also takes us backwards. So this is the time. This is the time. And if not now, we're going to miss the opportunities that are in front of us.
Harleen, you're doing some of this work to ensure that some of our trainees are exposed to this early on. Can you tell us a little bit about your work?
Yeah, thank you so much. So Medical Students for a Sustainable Future launched in 2019, really out of a need and desire for students. They were seeking a coalition and community for meaningful engagement in this work. And so as we're talking about transformational change at our academic institutions, I think some of the things we have to think about include transforming what our institutions value and make sure that we're putting priority on advocacy, you know, on par with how we value research. I think teaching clinical public health and the social determinants of health is so important and part of our responsibility to do no harm. But for medical students and institutions to engage in those lessons in a robust and meaningful way, similar to talks that I heard today, we have to align incentives. And so there needs to be questions in our board exams that reflect that this is critical and essential knowledge that all trainees must know. And then another question I get asked a lot is, how can we make medical students for a sustainable future more diverse? And I ask, how can we make medical school more diverse right back? Because this is, medical school is no easy feat to undertake, and a lot of minority students are going to be the first in their families with access or with opportunity for this higher education, and we need to find ways to decrease cost and increase opportunity and combat things like microaggressions that happen in a hierarchical system like medicine. And so I know for me, being a part of medical students for a sustainable future and really having the opportunity to launch and lead and grow this group over the last year has filled me with a lot of hope and given me a lot of resilience. Being part of a community that is eager and enthusiastic about this work also reflects a deep understanding among the rising generation of physicians that climate change is a critical and urgent issue and ultimately grounded in issues of environmental justice. I think our group's success is driven largely in part that we are student driven and student led. And so our community of 340 medical students and growing is both intentional and authentic about how we engage in this work. So we thoughtfully evaluate where our student voice will be most useful. And then we also think about where we can amplify already existing work of other allied organizations. And so all of our subcommittees were designed with this very philosophy in mind. We know that as medical students, as future residents, as physicians, there's only going to be increasing pressure on our time, and there's no need to recreate the wheel, where we can instead support and amplify the work of our colleagues. And so at any given point, our students are engaged in upwards of 20 projects across advocacy, research, climate smart healthcare, partnerships, communications, curriculum, plant-based health, ocean health, and we support the Planetary Health Report Card. And I think what's really helpful about these different subcommittees we have is that we don't only create space to foster the diverse interests of our members, but also to meet the level of engagement in which they are ready for. So we think about involvement across a spectrum of engagement, from learner, someone who's just getting used to this type of work or who's learning about it for the very first time, to an engager, someone who might be willing to commit a little more time or lead a project, to organizer, someone who wants to take on a national leadership role. And in all our efforts, we prioritize creating space so that everyone feels like there's an opportunity for them to get involved, because we know we're strengthened by that diversity. For an example, our 2020 research team, led by Carol Finesca and Emily Gentle, launched a National Journal Club initiative in partnership with Healthcare Without Harm. So every other month, there's opportunities for medical students to learn by engaging and attending these sessions about a specific topic in climate and health. They can connect with mentors or peers across different specialties or programs. For students who want to get even more engaged, they can serve as our Journal Club delegate and write a reflection for our member voice page on our website. And for students who want to get involved in a leadership role, they can develop those skills in a sub-chair or chair position. Again, with our curriculum team, our 2020 leaders, Natasha Sood and Sarah Shu, recently released the second edition of our curriculum guide to climate and health in medical schools. Natasha and Sarah brought together sample proposals, cover letters, syllabi, and online resources to equip medical students to be the champions for their own medical education. Students all over the country can reference the guide to bolster their personal learning, to advocate for local change, and to be a leader in driving progress. And I think that by consolidating the best practices across our whole community, we are able to be more efficient and more effective in driving progress. And so while we think about how to engage our members, develop their interests, and empower them with skills and resources, at the end of the day, we recognize that our most important value is that we are a community. And we know that to be resilient clinicians, staying connected to our purpose in medicine is so critical. And through collaboration, we hope to build resilience through this purpose-driven work. And I'm looking forward to seeing that work continue long after I graduate this May.
That is truly phenomenal. I don't know how you do this on top of being a medical student. It sounds like more than a full-time job. Dr. Bernstein, your work with Climate MD echoes a lot of what we heard from Harleen. Can you share with us a little bit about your work educating and raising awareness among physicians on climate change and action?
Well, sure. And, you know, it's only a matter of days before I'm looking forward to having Harleen be a part of the program and all those that she and others that she mentioned have cultivated in medical schools around the country. You know, the Climate MD idea was born out of a recognition that was really made apparent by social scientists who pointed out long before lots of us were paying attention that climate change isn't a scientific problem. Scientific is a cultural problem. It's a problem of how it's understood and where people's values are. And they also, of course, pointed out that it's politicized as a result. And people are not going to be able to get behind what we need to do if it's simply seen as a issue of whether the government wants to control our lives or not, which is how many Americans understand the issue. At the same time, it became increasingly clear that health messages were probably among the best ways to depoliticize climate, to make it personal, to make it actionable. And beyond that, the best messengers, multiple studies have now shown, are primary healthcare providers. And what was fascinating as this knowledge came out was that the conversation about climate change and health, which I've watched for 20 years now, you know, it's a long time coming, but it really has been at population scale. It's bad for where diseases will occur in various reasons. The asthma rates are going to get higher. Malnutrition at, you know, continental scales is going to be worse. It doesn't really matter to physicians in their day jobs. I mean, physicians, the surveys show physicians are very concerned as a group about what it means for their patients, but it didn't really hit home. So Climate MD is the response to that. It is the effort to elevate the voices of healthcare providers so that not only can we do work to understand how climate change matters to the practice of specific disciplines, whether you're a radiologist, ophthalmologist, oncologist, emergency provider, geriatrician, psychiatrist. And so you understand that as you prescribe a medicine or as you plan for a procedure, that you have to think about climate change because it matters. But in that process, in that understanding how climate matters to clinical practice, you get people's skin in the game in a way that wasn't possible previously. So that it's no longer a private concern in our personal lives, it's a professional concern. And then our hope is that we can use that as a means to get more and more people into this conversation for the very reason that we need to depoliticize climate change in order to see the progress. So that's the idea. And, you know, we've got this amazing collaboration with Caren at the New England Journal and with now many partners, medical schools around the country and around the world. And so we're really looking forward to the next steps in advancing this conversation to bring healthcare providers directly into the conversation.
Thank you. I totally agree with you about clinicians as messengers and the importance of sharing the stories of our patients and sharing them with key decision makers. And since you touched on that, I'd love to ask Dr. Solomon about messaging strategies. From your perspective as an editor of the New England Journal of Medicine, wow. What do you think are some of the most effective messaging strategies that we should be using to raise awareness, national awareness of climate change and action steps that need to be taken?
Great, thanks so much. So I'd say the journal's a part, but I kind of just going to run through a few because I've been thinking about that question. So I think key ones have already come out of this conference, which is, I just think the message of health as an impetus for climate change, and particularly the health of people's children, is just sort of a critical message to get more people engaged. I know I feel pretty terrible when I see this starving polar bear, but I think really kind of relating to people in ways that affect them directly is super important. Also thought about sort of the right balance between kind of inducing panic and generating hope. And I'm not quite sure, how best to do that, but I do think it's really important to, make clear to people who are not aware of some of the extreme health harms or the health harms that are affecting them every day that they're not appreciating. Sort of, you need to cause a little worry in that process, but if people just feel, anxious and frantic, then obviously that's pretty paralyzing. So kind of then balancing that with the things that we can do. And you guys have sort of brought that up here, right? What concrete things can we do? And we can minimize those risks and create a better future for all of us. So I think that's, another really important part of messaging. So I think, again, many of these have been covered, but we as docs talking to our patients, but also talking to our communities. Harleen mentioned, and others have mentioned, partnering with other communities. So I know that the group of physicians that I work with has purposely joined with some frontline community groups to do exactly what Harleen was referring to. So really listen to them, rather than just talk. I mean, sometimes we're doing a little bit of education on climate change, but a lot of the time is really spent trying to learn from them. What are the issues that we're actually not experiencing ourselves? And then, just as you said, really amplifying those voices. So using the positions that we have and the trust that we hopefully have to help make those voices louder. I think journals absolutely have a role as well. And I know at the New England Journal, we've certainly been trying, to get much more attention to climate change. The Lancet Countdown has been mentioned, and I know the Lancet has published a lot on that area as well. So we've had a lot in the journal of perspective content. We have a climate crisis page that links out to our relevant material to make it easy for people to find. One thing I should point out relative to this conference is that as part of our partnership, after this conference, we'll be hosting a discussion on our NEJM group website, really to just kind of talk more about these problems and get kind of a community interacting together and thinking through some questions and solutions. I would say one other area that I want to mention that Ari really alluded to, but I think in our messaging, a really important piece is to kind of shift the focus from people's kind of personal actions and responsibility to the fact that this is just a systemic problem. And in that regard, the role of the fossil fuel industry in having generated much of that problem. So I think people have probably seen these figures that like 70% of greenhouse gas emissions come from the top 100 fossil fuel companies and the use of their products. And so I don't want to say that personal actions have no role. I think it's useful to talk to people, particularly in clinical settings. Yes, it's better to eat less meat, for sure. And if we all didn't eat much meat, that would be way better for the environment. If we walk rather than drove, those are important. But we could all do that. And as you guys all know, obviously, we would be very, very far from solving the nature of the problem that we have right now. So I think sort of taking that sort of guilt off of people, well, geez, I don't recycle enough or something, and pointing out the structural issues. And again, how fossil fuel companies have sort of publicized and spent a great deal of money, sowing skepticism and supporting politicians, and really kind of getting people to think about that end of it and how we can respond, that it's not just that we need to ride our bikes more is a part of messaging.
Thank you. I'm going to turn it to you, Peggy. We act as really seen as a regional national expert in making sure that messages get out to diverse populations. Can you give us some advice on how we do that as a medical community?
Wow. Well, obviously, the clinicians and researchers are going to have to be informed, and they're going to have to be informed enough to begin those discussions with with your patients. Certainly, likely the most important climate issue that will be evident will be extreme heat events, and how you're able to message that to your patients will be important. Understanding whether they have the access to cooling, understanding whether they have support, especially if they're elderly or disabled. I think really understanding the conditions in which they're living, to be able to provide either referrals for assistance, or what they should be doing to protect themselves specifically. And one thing we've been doing is trying to work with the city around the cooling centers. And I really don't think cooling centers are the answer, but it's the only answer the city has right now. And so I think the air conditioning situation was an important one. They did try to give out about 60,000 air conditioners, and we were very supportive of that, trying to push that early on in March when we realized everybody's going to be at home in the hottest months, and they're being told to stay there, and what will that mean? And so they did begin to push those air conditioners out, but they had the messaging wasn't there. They had a complicated process of robot calls to home phones. A lot of people don't have a home phone. Then you had to call another number, and it was just a whole bureaucratic maze. And so when they saw it was failing, they began to reach out to community organizations to help. But it was pretty late at that point. It was almost September. And so they still have a whole cache of air conditioners that they were never able to give out. And of course, having partnerships with places like Mount Sinai and medical facilities where you've got people coming into you. You've got a captive audience in some of your clinics as well. And that's a great place to begin that messaging. You've got people sometimes sitting for an hour waiting for their appointment. That's a good opportunity to do some of that messaging, and maybe even to have a social worker or a postdoc or someone who can develop some relationships and talk to people as they're waiting about some of these issues, I think could be very important. And then of course, there are always loads of papers you've got to fill out as you're waiting for the doctor each time. And perhaps surveying people as to, what access they have begins to be important too, for that doctor to be able to provide the right kind of information and referral. So policy becomes really important here, because I believe that cooling is as important as heating. And so changing the rules around LIHEAP, which is a state and federal policy, becomes really important. And again, the data that you all can show would make a very big difference to state and city policymakers.
Thank you, Peggy. And I know you and your team at WeAct have been incredibly generous in all the trainings and educational outreach you've done for clinicians, residents, medical students at Mount Sinai and beyond. And that's done a lot to move the needle forward. And just wanted to thank you for that. I'm going to
be happy to do more.
I'm going to turn to you, Dr. Butts. So I'm an alum of Mount Sinai, graduated in 1998. So I saw firsthand the transformational change that you've been leading at Mount Sinai, to the point where a pediatric resident said to me, I came to Mount Sinai because of its diversity. That is very impressive. Can you tell us how we got to where we're at, what it took to get there, and where do we need to go?
What a big question. Well, first, the good news, and as I'm looking at Peggy and Lynn and others I haven't worked, Emily and others, and you, Maida. This is our work, right? And I think, so that's number one. And back to the opportunities, and while many of us have been at this work for decades, literally decades, this is the opportunity where I, and hopefully we as a system, are seeing a more regular declaration that this is important. It's no longer whether it's important or not, whether we address diversity, equity, inclusion, but how. And frankly, how we become the best in this space. That's just like we aspire to be the best in the space of clinical medicine, research, and education, right? And so, this is over, a bunch of decades, equity, diversity and equity are really becoming the core value that it's deserved to be for a very, very long time. And that ultimately will translate into a lot of what students, trainees do see, feel, learn, and then how we apply it as faculty across the board. So I've been privileged to be occasionally a person in a place at the right time to lead. I'll tell you, I was sitting at a table. This was just after George Floyd's murder. I'll call it what it was. When the dean looked across me, and I just happened to be there and asked, what happened, and help us understand it, and what do we do? Well, okay, and so we agreed that this was bigger than a medical school. This had to be, if we were going to get into the space and lead in this space, a systems approach. So our response was, and you have to look, if you haven't, anyone has it, that United in Solidarity 2-minute clip was incredible. And it was one of the proudest moments for me back in my 40 or so years here at Mount Sinai, when we came together as a community and said, enough is enough, no more, right? So we now have not looked back, and this has become a moment to accelerate existing work, launch new work. And Lynn, as you know, is co-director of a new Institute for Health Equity Research, which began around that time as part of a response, even before we began to respond intentionally as a system. And then probably even more important was the agreement that we will listen and learn together. We will listen, learn, and grow together to become comfortable being uncomfortable in this. That important, right? So we're still healing from that. And now, we get shaken up every week because of another major event. And then finally, more deliberately, has been the launching of a task force to address racism. That the roadmap is pretty much complete. It's under review. Will be presented for approval very, very soon. And then the real work begins. So that will really position us to be deliberate, intentional, and very serious with the reasonable investment, time, effort, resources to both lay out the priorities, address the priorities, and set forth the path to getting there. And you can imagine the lift that this will require. I think most important is this, and I alluded to it earlier. We don't have time to go into the details, but everything from care, the unevenness that exists in care that's delivered, and we're not unique, but this is really about Mount Sinai right now. From what we look like, who delivers the care, who the leadership are, and the climate, all of that, and then some, right? But here's what's going to make it particularly special. The accountability is ours, not just mine. The accountability begins with the board, our board of trustees, who will have to embrace, who we want to embrace the roadmap, the path forward. And then it's about having experts like Lynn Richardson support how we measure impact over time. So this is an all hands on deck opportunity. It's a very special moment for us. And while we've been pretty good at it, frankly, and have really good impact over time, as we move forward, we're going to be the true leaders in this space. And hopefully, as we do it in a more direct and intentional way, we will set the model for others, other academic health systems to follow.
Yeah, if I can just follow up on what Gary said, because I love that you acknowledge really the work that Gary has been doing here for 30 years. Anyway, some large number of years. And, you know, it has been slow and steady, sometimes in fits and starts, but always pushing forward, always looking for new ways to support the people who were here and to attract people who were not here. But I completely agree that now this is a different time where there is an opportunity to take this to a whole nother level. And I think the difference is that it has now gone from being a small group of very committed people working very hard to a recognition that everybody has a piece of this and everyone is going to be held accountable for accomplishing their piece of this. And I think that's what has changed. You know, I'm you know, a quantitative investigator, do a lot of qualitative stuff now, but certainly quantitatively trained. And I believe in data, and we are going to measure it and we are going to monitor it over time. And we are going to be giving constant feedback as to whether or not we are really achieving the goals and making the progress that we say we want. And it is going to be attached to how people are evaluated in terms of how they are succeeding at their jobs, no matter what your job is, whether you're a practicing physician or, you know, you're the chief operating officer. There are going to be metrics that are tied to equity. That's how you embed it. That's how you unearth the structural inequities that are embedded. You change the incentive system. And it's going to be a very heavy lift, as Gary has said, tremendous amount of work. But I feel really for the first time that maybe we are all in it together, not sort of the small we, but the everybody now has a piece of this. And so it's a really exciting time to be at an institution that is committing to make its own transformational change. And we're gonna take this and push it as far as we can, as fast as we can. I think it will be sustained, but I know we're going to get a tremendous amount done. You know, one of your questions was about a success story. There are things I have been working on for decades. I've been at Sinai almost 25 years. And in the last 6 months, I've been able to push them over the finish line because finally there is the, you know, there is the desire at the highest levels to empower me to do these things. So it really is a different time.
I'm going to add one last thing real quickly to that. I was asked by another senior exec offline, this is after, you know, whenever the term race comes up or racism, and people look at me, so he calls me, he said, how do you handle that? I said, well, what are you talking about? And so then we got to, he said, well, you know what I'm talking about, what does that feel like? I said, well, I can't tell you what it feels like. I just have to be ready, and I expect that that's going to happen. But I tell you what makes it feel a little easier is knowing that there are people like you who might occasionally be prepared to carry the water. And you know what? At the next meeting, he did precisely that. He stepped up, and that is happening more regularly. This is back to the sharing of the accountability. This can't just be about people of color and women and the disenfranchised. It's got to be, the folk who have the privilege and the power have to be part of this and agree to lead. And that I have learned over, decades, and it's happening in some very genuine ways now as part of our work.
Yes, I'm seeing that too. I'm having the same experience now. So,
yeah. Well, I had the same experience this morning with Dr. Bernstein and Dr. Wright. They could have given my speech. They gave part of it. So I was like, yes. The usual suspect isn't saying it.
That's exactly right.
The new Mount Sinai.
I love the concept of metrics at every level and buy-in, ownership and partnership at every level, and the accountability. And also that all of you have been rolling these very heavy rocks up these mountains for many decades. And into this window of opportunity for change, and just want to thank you all for doing that. And so that leads to this next question, is what inspires you to keep going despite all the challenges that you face? And I'm going to turn this one to Dr. Bernstein, because climate change in and of itself has been one that feels insurmountable to many, and perhaps a battle that we fear we can't win. So,
yeah, it's a totally fair question, Maida. And you know, the good news is that when I think about it, there are lots of things. You know, I got people, when I started doing this work, people would say they do a double exam. So you're a pediatrician. What are you doing with climate? I mean, literally, this was the conversation I had for years. What do you care about climate change? And so and at the same time, probably because of some luck of my educational career, it sort of felt like if I wasn't dealing with climate change, I wasn't really being a good pediatrician, because, you know, our job is to really keep kids healthy. And it's hard to think about keeping kids healthy in a world in which the climate is completely unconducive to being healthy. So that's what keeps me going, is the recognition that, you know, I actually really do love what I do. And this is a part of that. I have children, and knowledge is powerful, but it's also painful. And there's a huge amount of motivation, not just for them, but, you know, it's hard to look at the children I care for and think, boy, we really need to be doing something better for them. And I think, frankly, on a more day-to-day basis, the biggest thing that keeps me going is the fact that you know, I'm in an academic institution like many of us, where I'm constantly engaging with people who are younger than I am, who are frankly just waiting for people like me to get the hell out of the way, but also are constantly giving me a kick in the rear end. And I would say the vast majority of how I think about climate change isn't my, you know, in fact, none of really what I think about climate change is my own. It's because I've been enormously fortunate to be around folks who see this issue in ways that I never would. And whether it's in the material that winds up in the courses I teach, whether it's in how I think about climate in the clinic, whether it's in how I talk about it in wherever I'm talking, you know, there are people who have really been kicking me in the pants, and they keep me going. So those are three of many things that really keep me going. And you know, speaking of that last point, the reality is the things we need to do for climate are the things that I need to do as a pediatrician anyway. You know, obesity is a major problem. I can't fix that with a pill, but we certainly can fix that with better diets and better transportation systems. And, you know, those are changeable things. Obesity, you know, when I was in medical school, was like a rarefied disease. It was, you know, like a super subspecialized thing to study obesity and type 2 diabetes. You had to be some sort of hermit. And now it's an enormous burden. So we can fix that. We can fix that, and we can do something about climate change. And so the positive changes we can make for the health of the people we care for equity that come through climate actions is a really a wonderful thing to have to chase after.
thank you. And one final question before we take a question or two from the audience. And I'm gonna throw this one out to Harleen and Caren. What's your single take-home message from today that you want to share with the audience?
Wow, there's been so many wonderful things said. It'll be hard to sum it up, but I think, you know, one of the biggest things is that while we think often about these issues as a threat to health, there are often also can be framed as an opportunity to reimagine a healthier and more equitable future. For me as a medical student, I see with my colleagues that we feel the urgency to address this issue as future physicians and you know, out there practicing in our communities. We recognize the power of our voices and the privilege that we have in serving our communities, and the responsibility to use our voices to amplify the needs of the communities that we serve. I think if I had a single take-home message, it would probably be that included in our duty to do no harm, it is our responsibility to promote equity and inclusion and to collectively address COVID-19, climate change, and racial injustice. We cannot lose sight of our profession's grounding in humanity. And I truly think that by centering ourselves in humanity, we can not only lead robust solutions, but we can also generate hope to drive progress.
It was a wonderful answer. I'm going back to sort of my first answer, which is remembering how equity is at the root of all of this. And then I think what has certainly come up in all the conversations today are the collaborative efforts coming from basically different disciplines, but physicians working with non-physicians, with frontline communities, with communities of color, and that need for that broad collaborative approach to really pushing forth an agenda. And I want to say, you know, unlike Ari, I came to this later. I wish I'd come to this years ago, but for me, it's really in the last 3 or 4 years that I've been really worried about this problem. And it actually started with my kids pointing out to me how bad it was. So Harleen, you know, your generation, I just think has been extraordinary. And if there are students, you know, watching today, I think that certainly there were some people like Ari and others who were onto this before, but I think it's really that sort of, you know, youth kind of knowledge and speaking out that really, you know, made a lot of people who are of older generations really start to pay attention. And then sort of the more I learned from colleagues and from reading, et cetera, the kind of more engaged I became in trying to, you know, to hopefully do something about this. And I would say that, you know, those relationships also that I've been able to make in this process are also really sustaining. I think that it's a way that people obviously find hope in trying to do something with other people.
Absolutely agree with you. This environmental health community has been a refuge in trying times. We have about 5 minutes left for questions. I have one for you, Peggy. You mentioned something this morning that really resonated with me. It was the Center for Partnerships. I think that is a fabulous idea. How do we make that happen? Where do we get the funding? And if Lynn can give us thoughts on what metrics can we use for partnerships so we can show the ROI, return on investment of those partnerships?
Yeah, certainly there are donors, perhaps the NIEHS as well. But I think it's very important to have an office that can help structure, provide structure to researchers who've never done partnerships before, to help them understand the level of the type of community groups that exist in the surrounding area that they could partner with, to develop principles of how to work together. There are a lot of you know, negative stories about working with researchers. And we need to have good stories. We need to have equity in those partnerships. We need to have a balance of benefits going to all the stakeholders in that partnership, as well as resources. So really beginning to find funds to develop those kinds of offices. And a lot of corporations have social justice funds right now, with millions of dollars there. So I do think an entity like Mount Sinai could be very competitive for getting some of that funding. And you know, really begin to reach out to and meet with some of the advisory board that you already have, and really talk about how do we set up principles of engagement? How do we link community partners with researchers? How do we train researchers and community partners to work together? We started some of that with one of the advisory boards we were on together several years ago to do that kind of training. I think we did sort of a research 101 for some groups, but we could do more of that. That was sort of an initial step to kind of, you know, get our feet wet there. But I think those kinds of workshops to really let researchers know what the benefits could be, because it does take more time. You know, it does take a sharing of resources, But I think, getting someone in that office who can really begin to structure the way partnerships could look and to do the training that begins to, link the researchers with the proper community organizations based on what the researcher is looking to get and based on what the community partner is really interested in doing in their community.
Peggy, I feel like everything old is new again. I'm pretty sure we had this conversation about community partnerships about 15 years ago, right? When we were writing a grant together. So I agree completely. It is about building relationships to really engage with community organizations in research. Many of the things that you spoke about, Peggy, some of which we did do in a past life under, a different model, are things that are going to very much be a part of our new Institute for Health Equity Research. And you were on my list of people to call and talk to about some of the things we want to do going forward. But to answer your question about metrics, I think it's really important to understand that part of what needs to be evaluated is the partnership itself. And there are measures for doing that. It is about equity, and that is both equity in terms of making decisions about what the research questions are, how the research is organized, who gets paid. I mean, I can't tell you how many times in the past you might be in a room and there's a community representative who's a volunteer and everybody else in that room is getting paid to work on that research. That can't be the model. And so we need to both evaluate the partnership itself, the process that we use to move forward, and we need to be very specific in the objectives about what we're trying to accomplish with that partnership, so you will actually know you've made a difference. I think all of us are really committed to doing things that actually make a difference, that change what is. And so you have to figure that out in advance and how you're going to measure it. It's not just about doing things that seem like a good idea, but you actually have no evidence that they work. And so it is bringing that focus so that we can figure out what does work, and that's then what we can scale and disseminate and replicate. So I look forward to our next conversation, Peggy. We have a lot of work yet to do together.
I just have to make a comment. When I said, Peggy, I said, because you're reminding me of the good old days, and it's, and back to what keeps me at it. I think, I've never felt alone, right? And I think, seeing you, Peggy, still at it, makes it easier for me to stay. Len and I go back to medical school, okay? And she was just as authentic and active and energetic then as she is now. And Harleen, when I see you, I'm a simple guy, yucky fan from Brooklyn, right? And all it takes is a smile of a medical student on a Friday afternoon. That's made my day, my week, and just reminds me of why I do the work I do. And you are a direct link to the communities that we commit ourselves to.
Yes.
So thank you.
Yes. But we have no choice but to continue to work on this. This is who we are, not just what we do. So there really is no choice.